Well, one of the other big stories that we are tracking, the shocking loss of lives at a premier hospital in Goa as a result of oxygen not being present in adequate supply. Now, this has also come up in the High Court, which is where actually accounts of the number of deaths which took place on the 12th of May. 15 deaths, in fact, have been reported, and that came up. The High Court continues to look at this and to look at how oxygen supply can be increased. Joining us now for a little bit more on what exactly happened, Shruti Chaturvedi, the founder of a media company, Chai Pani, who's also started a COVID Care Goa initiative. Thanks, Shruti, very much for being with us. In fact, we don't have Shruti just yet. We've got Dr. Shekhar Salkar. He's the former president of the IMA and president of the BJP's Medical Council. Doctor, how could this even happen in the first place that oxygen ran out? Unlike other hospitals, for example, in Delhi, which were constantly sounding an SOS, why was there no SOS sounded by this hospital?
See, Goa Medical College is the biggest hospital, having almost 1,200 bedded hospital, and they were running on the what is called as those trolleys. They don't have that liquid oxygen. While the new hospital, which is built of 500 bedded, that is having a liquid medical oxygen plant. And even the South Goa District Hospital has got a plant. So they are having no problem. These are like the old structure which is having. It needs to be changed over a period of time. But now we cannot do it. Now we have to still run it on the trolleys, because the trolleys are in the requirement has increased tremendously since this has started.
So doctor, the trolleys have oxygen cylinders on them, right?
We are having 1,000 patients there. It always becomes a difficulty in supplying oxygenation at this everybody.
No, so the trolleys had oxygen on them, right?
Yeah.
And you ran out of oxygen cylinders.
There are almost 70-80 jumbo cylinders on a trolley, and the trolley.
You ran out of jumbo cylinders. Is that how 15 people died?
Problem is at the night time, at the 2 to 4 o'clock position. That is a time when maximum problems occur, because everybody is in little bit in sleepy mood, and the oxygen of the patients also normally comes down because they are lying down and they are sleeping. So they are breathing as a
no, but Dr. Salkar, I don't think there is anything that justifies the death of these patients, sir.
I agree with you. There is nothing we can do.
I'm just trying to understand why wasn't an SOS alerted?
Ultimate aim only.
Why
but
was
we have to find out, is the oxygen is the only problem, or there was other problems also, like the patients already having a very advanced disease and they have been on the ventilator.
But 15 patients,
so they will also be having to have a problem, because the survival after ventilation in a COVID patient is more than around 90% will die anyway. So those deaths are there.
But sir, we don't know that as yet. We do know that oxygen had gone down.
26 patients or 28 patients.
No, doctor, this is a bit problematic what you're suggesting, sir. Let us assume, we are not guessing about oxygen being, not there. It's come up in the High Court as well. We take that, the question is, why was it not there? Now, if there was a shortage, why wasn't there an SOS? If there was an SOS, why weren't people listening to it? Right?
Hello? Yeah.
So I think that's the key. But I want to go across to Shruti Chaturvedi, who's been highlighting this very prominently. Shruti, to the best of your knowledge, what went wrong? Why did oxygen run out? Why was there no effort at trying to get this?
So from what I know, I do not know a lot of medical terminologies, but I got my first SOS call at around 11:30.
I see.
It was an unconfirmed news for me, saying there was a fluctuation in oxygen in the central pipeline. There was not a shortage of oxygen cylinders. There was a fluctuation in the central pipeline. And that's when I got in touch with the doctors, and I got in touch with doctors in different wards, asking them. They even sent me videos of the machines beeping because there was a fluctuation in the pipeline. And it took a lot of effort, because by 1-2 a.m., like almost every health personnel that we knew, all the administrative officers, everybody was asleep and nobody would pick up the phone calls. The doctors at GMC, they have a escalation number that they are supposed to call in case of an emergency. And this particular doctor tried calling that number, but even that number was switched off. She tried calling the Scoop Industries, which is the supplier, the official supplier of oxygen to GMC. She even tried calling there, but even that number was switched off. And this was a condition of the doctor, that she had to ask volunteers, like we are just citizens and we are not like health officials or anything. They had to ask us to highlight this so that something could happen, and we had to take it on social media. Is when the police reached GMC. They confirmed that yes, there was a problem with the oxygen supply. So there was a fluctuation, and it fluctuated from 60 to 90. And this has not happened once or twice. This happened at least 8 to 9 times across the night.
Was this because of a shortage of supply or because the system
It has
wasn't
to be
working?
shortage of supply because
There was a
so
shortage.
so the patients, the ventilators to run properly, they require a very high flow oxygen and very consistent pressure of oxygen. So there was a problem with the pressure. Now, as I'm not a technician, I would not know if it
Right.
was the supply problem or was it a technical problem with the oxygen pipeline. But
I think the
clearly
point that
problem-
you are mentioning is that there were calls which were made and that there was an escalation matrix and nobody
Yes.
picked up the phone.
No, it was switched off. Let alone picking up, it was switched
And
off.
who was making the phone calls from the hospital?
The doctors who are stationed at the ward, so ward 147, 145, 143, all these doctors who were at the wards, they were making the escalation calls, but the phones were switched off.
And 15 people died overnight.
Yes.
What did the High Court actually say?
The doctor that I was speaking to, she said she was so worried because such a wide range of fluctuation can cause hypoxia in the patients that can cause permanent brain damage to almost most of them.
And you were the petitioner in the case in the High Court. What did
Yes,
the High
I am.
Court say?
Yes. So today the High Court has asked the center to look into this because yesterday's entire hearing, which lasted 3 to 4 hours, the entire hearing was about solving the problem at GMC. And I mean, from a TV show, what all that I can request is for us as citizens, okay, the government, if at least they can be honest, because we are not here to like play the blame game. We are only here to
Correct.
help in any which way possible. So even in yesterday's hearing, initially they said there was a shortage of oxygen cylinders. During the course of hearing, we arranged 100 oxygen cylinders. We said, okay, what next? And they said there's a logistics problem. We arranged tempos over WhatsApp and Twitter. That's it. And we arranged tempos as well. Then they said the supply is the problem. So if the government and health officials, if everybody could just be very transparent and honest, and because I think that's the step one of solving any problem is at least acknowledge that there is a problem.
Yeah.
So
thank you so much for
so 15
highlighting
people have
this.
died. We can't pinpoint and say that they died because of the oxygen shortage. But yes, 15 people have died. In fact, in one of the wards that I was coordinating with directly, 2 patients died in that ward itself.
Dr. Salkar, are you still there?
Yeah.
Dr. Salkar, the escalation matrix exists. Nobody was picking up the phone. Isn't that what this is all about?
No, if somebody is not picking up the phone, somebody is not doing his duty, if he is supposed to do, then he has to be punished by the government. See, there has to be some amount of accountability from all the officers who looked after this. But problem is the system is not very up to date because of oxygen of this 1000. It's an old oxygen trolley system. And the trolley system always has a problem when they're shifting the trolley to one trolley to another trolley. There is a different, definitely there is some amount of pressure goes down. But I think that may not be the only cause. It is one of the causes. There are so many other causes also to look after. That's why I wanted a proper audit of all the deaths. It's very important to audit all the deaths. That
Absolutely.
they were dying only because of oxygen or there were other disease causes.
And hopefully
or
that's
there is
a process
something
that
else
can
is
actually
doing.
take place transparently. Right?
To be transparency. That's
Right.
why I told
Absolute
them, you
transparency.
take the presidents of all
Absolute
the
transparency.
associations,
15
let
people
them
dying
go inside,
overnight.
have a active
Let us
watch
not
and
for
then
a
come
moment.
back.
Let us not for a moment sort of suggest that perhaps there were other reasons and not oxygen when there is clear evidence of oxygen not being there. Sure, let there be post-mortems to decide this, but let there also be an audit of the system which collapsed overnight. Thank
Absolutely.
you, sir.
I fully agree for that.
Yeah. Thanks, Shruti, very much for highlighting this. What would one do without citizens like you? And for taking it to court. Thank you. Thank you very much.